I'm going to be giving more of a worked example of how to write this section with your kind of limited word count. I'm giving a really specific example, obviously, just to give you a worked example. So as we're going through this, just think about how does this apply to your research topic, your research area? How can this be meaningful to you? So obviously it's just a very narrow example, but you've just got the opportunity to think, actually, what does this mean to me? How can I use this information to make my application as succinct, as clear, as transparent as possible for the reviewers? And so it's really understandable to them, that you make a lot of your justifications so that people can understand your thinking and that it's going to be a successful research study. It's really great to start when we're thinking about our method section about the stating the design of your study. So being really explicit of what it is. This could be a double-blind, parallel, randomized control trial, or whatever it is that your study is. So being really, really clear and making sure that it has relevance to the objectives. And this is where you need to think about your level of justification to the work that you're doing. And this will be really unique to you, because is it a novel approach? Is it likely that your reviewers are going to be familiar with this or unfamiliar? Is there an approach that is maybe more obvious, that they might be more familiar with? So we need to be thinking about that, and also the extent of the limitations with the choice and the approach that you're using. So you have an opportunity to think about the level of justification that is required depending on what you've selected. So just be really clear of that. And I would always err on the side of caution that actually the people reviewing this might not be as familiar and as confident with these choices as you are. So make it really explicit and be really clear on those justifications of why this is the study design that you're using. So this is going to be the worked example that we'll use through this session today. I'm aiming to finish around 11. I will do my best so that we can go to break on time. So we're going to explore the research question of what is the effectiveness of motivational interviewing compared to usual care in uptake of pulmonary rehabilitation. Sophie mentioned some of these points as well earlier about thinking about usual care. What does that actually mean? And we're going to talk about that and how you might address that in your application. So we're thinking then, what are our objectives? What do we need to find out to answer our research question? And each of those are going to have potentially a different design element. So we need to be thinking about, okay, this objective, what does that really mean? What's it actually going to look like? So we need to refine the face-to-face motivational interviewing intervention for use over the telephone, which then is an intervention development section. We're going to determine the effectiveness of using clinician-delivered motivational interviewing with respect to uptake and completion of a PR amongst eligible patients. This is going to be our randomized control trial arm of the study. We're going to assess the fidelity of delivery of the motivational interviewing, which is part of the RCT, part of that randomized control trial. We're also going to explore the acceptability and perceived utility of motivational interviewing among patients and clinicians. So this isn't likely going to be part of the RCT. It's going to be a nested qualitative study. So you can see that we've got these different design elements when we're thinking about our bigger research study. We also want to explore the barriers and facilitators to delivering motivational interviewing, which again would be a different nested qualitative study. So we've got multiple design elements here that we're going to need to be able to explain, explore, and justify. So if we're thinking about how to make this succinct, we're going to say that this study is a randomized control trial with nested qualitative study and prior intervention development. It's steering our reviewer to know exactly what's to come. It's really logical, and it's explaining our direction of travel and what they're going to be expecting to read and to explore in further information. You can also include here, if it's relevant, if there's randomization, if there's allocation, and if there's blinding. So just think again to yourself, what's relevant in my research and in my study. So we're going to want to include reference to our setting and our sampling. Again, this is really down to you and your individual, but thinking about, I always like to recommend to researchers that they think about where their relationships are, where because the reviewers need to know that you can complete this work. So if it's a space that you've worked in previously, it's a space that you have great relationships already with, that commitment to being able to use those settings are really clear then. So it might be the community hospital that you're based in, or another member of your research team is based in. So we're thinking about where that setting is and exactly what sampling method you're going to use that makes your study achievable, that it allows you to answer your research question. So this is where it gets a little bit more complicated, and you really need to think of every potential limitation, every potential thing that might delay your recruitment, that might stop or delay recruitment to your study. And when you're thinking about your population, Sophie touched on this earlier as well, about your inclusivity, thinking about equality, diversity, and inclusion all the way through this study design. And when you're thinking about your population of interest, I think it's really important to think about, in whatever study and whatever field you're in, whose voices, or who is often not recruited into these types of studies, whose voices are missing from our evidence, and what can you do to support that, to support them to be taking part in this particular study. So we're thinking about our population of interest here. This is going to be supported by your eligibility criteria, and it's also going to be supported by your setting of the recruitment and who is facilitating and supporting that recruitment to the study. So when we're thinking about our inclusion criteria here for this specific motivational interviewing intervention, we've got a list of inclusion criteria here, thinking people who are over the age of 40, diagnosis of COPD in a clinical record. So we've got multiple points here. Then we've gone to our inclusion criteria. And we've got two really key points here. And one is that the responsible clinician feels urgent referral to hospital is necessary, so meaning that they cannot take part in our study, or there is severe illness. And one of the points that comes up quite frequently is that people will put their exclusion criteria as the opposite of their inclusion criteria. So if we're thinking age, somebody might put exclusion criteria is 39 years or younger, which doesn't need to be stated there, because we've got our inclusion criteria. And your exclusion criteria is, if somebody met your inclusion criteria, what would make them not eligible for the study? So those 2 points there come on top of somebody already being included, could be included to the study. So that's really important. It's not, the exclusion is not a reverse of your inclusion. It's thinking, if somebody was eligible, what are the points that might make them not eligible any longer for this study? So be really clear on that, on what those points might be. So I think that's quite straightforward. And then this helps us, having a flow chart using diagrams can be really helpful in your planning stage, and also in your application, and the use of tables as well. Helps you reduce that word count, helps show real structure and flow, and it can help you organize your thoughts as well. So at the recruitment stage, when you're thinking about identification, screening, initial contact, and consent, it's really important to think about who is carrying out these steps, which members of the research team, and how does this fit to the current care pathway? Is it a burden on the usual clinicians? Is it a burden on the participants that we're hoping will take part? So if you can step this out, have that logical flow, you can think about who is doing this, the time it's going to take to do, the time between those different steps, the identification, the screening, to help you really manage the program and think what is achievable within the time frame that you have and within the budget that you're requesting. So you could use something like a consort style flowchart here. So at the identification stage, we've laid it out here to be really specific about who would be doing this. So all people referred to participating pulmonary rehabilitation programs will be screened. So there's nobody that's not going to be screened. Then the PR teams will identify those with telephone contact details for that initial screening. Those who are eligible will be sent a participation information sheet, and then consent will be audio recorded over the phone. So you can think about how and where this will be done, and think about the burden that becomes to the participant as well. It's really important to consider that and think about what you can do to reduce the burden. So in the recruitment, this is a little tongue-in-cheek slide that says in clinical research, the prevalence of any disease falls to about 10% of what you thought on the day that you start to look for your cases. It never goes as smoothly as we're hoping. So you need to build in your kind of planning stage, you need to factor this in. So what can you be doing that allows you to maximize the chance of recruiting the numbers you need into your study? So we need to be realistic. We need to be sometimes thinking of worst case scenarios, and we need to put in a lot of detailed planning. So in this study, we're thinking, realistically, we need 350 participants to allow us to have generalizable findings. But this hasn't considered what uptake to our study will look like. So it's really important to look at previous work. What does that show us? So previous work in this space reported uptake of about 50% and a dropout of around 20%. So this means that really we need to recruit 438 people, and to reach our 438 people, we really need to be approaching 876 people. Now, to do that, how many sites do we need to be working at? And actually, maybe we can't just go to the one site as we initially thought with our 350 target. So now we're aiming to recruit or, reach 876 people. If we see about 150 people per year, we really need to be reaching 6 sites to successfully recruit our target. But what about the eligibility criteria of the people attending those different sites? Is that going to impact on our recruitment? Yes, absolutely it is. So we'll see about 100 eligible people per year. If we get to 9 sites across 14 months, we'll reach our target. And do similar sites see similar figures? So do the other sites see similar numbers? Do they see the same number of people attending those clinics and within our eligibility criteria? So overall, we're going to need 70 eligible people per year. If we get 11 sites recruiting for 14 months, we'll reach our targets. But are each of the sites open and working in the same way as each other? They're not. They're often not. So with a staggered opening of 2 sites per month, we require 14 sites recruiting over 14 months. So this gives us a much more specific, targeted statement on our recruitment, where initially it said a local audit suggests 150 people per year come through our service. We will therefore recruit from 6 sites over 12 months in order to achieve our target sample size. But actually, this is a much better, reassuring statement to our reviewers. Based on previous studies, we anticipate uptake of 50%. Insert your reference, and retention of 80%, insert your reference, suggesting we need to approach 876 people to achieve a sample size of 350. A review of our study sites suggests a mean of 70 eligible people per year. We anticipate opening 2 sites per month and will aim to open the larger sites earlier in the recruitment period. We will therefore recruit from 14 sites for 14 months. And that really gives reassurance to the reviewers that you understand what's needed to reach your recruitment target and to reach the sample that you're hoping. So we can also use the consort style flowchart to think about the study process, the data collection, and the data analysis as well. So what happens, the question here is really what happens now a person is in your study, and how does it fit with the current care pathway? We can go into this in a little bit more detail here as well. So once the person is in, they've given consent, they move into the randomization, the intervention, and the control. Then we've got our data collection and it moves into our analysis. So when we're thinking about that randomization, this really talks to the point that Sophie raised earlier as well. How is randomization going to occur? When and in what ratio? So following consent, participants will be randomized to intervention or control into a 1-to-1 ratio using an online randomization service. But we need to say, is that allocation concealment and blinding upheld? Is it possible? Is it feasible in the work that you're doing? Okay, in this example, it's not possible. So you need to give that justification. So, following consent, participants will be randomized to intervention or control in a one-to-one ratio using an online randomization service to preserve allocation concealment. Blinding of participants, those delivering the intervention, and those collecting data will not be possible. However, given the objective nature of the primary outcome, we do not see the biasing that, we don't think the biasing of the results will occur. And that's the kind of justification that you need to be giving. Um, Also, it's really important to explain the intervention because we can't assume that the reviewers will be familiar with motivational interviewing. So how will this be delivered, when, by who, and exactly, what is involved in that? We are working to a very limited word count, so it needs to be succinct and clear, but some explanation of the intervention will be necessary. It just gives you an example here. I'm not going to spend too long on it because I want to move through our other slides. Again, following usual care, what does this look like? And as Sophie mentioned earlier, this could look really different in those different sites. So this statement here gives a general feel of what could be included in usual care. So the control arm will follow usual care as practiced by the participating PR program. This is variable and may involve an appointment letter with or without a program-specific information pack on PR. So we just need to be really clear on that. We've got a great example of the types of tables that could be included in your application. Data collection is really important to think about what you need to collect. What is essential data that you need to collect to answer your research question that is needed for your analysis? Sometimes we get into a habit of this would be nice to have, but is it essential? Think about the burden on your participants and how that data will be used and the justification for collecting that data. So this just echoes that really. Is everything you're asking for justifiable? Are the methods or tools you're using the most obviously suited to answer your research question? And is it clear how the data will be collected? So kind of when and by who? So our outcome measures here, we have our primary, and then we also have our secondary outcome measures. So thinking that our data is going to be used to answer those research questions. Again, for data analysis, we're thinking about outlining the steps of the data analysis plan to each of those different arms of your study, explaining why these particular methods are chosen, and explaining how they relate back to your research question is really vital here. So we need to be thinking about a summary of the data collecting, what's being collected, what tests are going to be used, how is effect size going to be shown, and will the confidence intervals be provided, and why that's important to answer and going back to your research question. And the final part I want to just touch upon is the project management. So being really clear on the team structure and roles, the timeline and milestones of the study, and thinking about quality control and monitoring, and at what points of the study that these come into. So just to a really, really quick summary here is we're thinking about the design. So we need to be talking about which groups of people are of interest, and why. So why are those people important to the study? How is this setting your eligibility criteria? How will you get them into your study? Who and how will support this? What will happen to them once they're in the study? What will you do with the data that is collected? And what will you do with the results? It even ties into that dissemination and knowledge mobilization.